Hi there, this is for our MSK complex, the presentation for DeQuervain's disease by Mallory Ciccolo and Shravya Cavella in July 2015. To start off, we wanted to touch up on what exactly DeQuervain's is. It tends to include a painful inflammation of the tendon sheath located at the base of the thumb, and that's because of the tendons there called the abductor pollicis longus and the extensor pollicis brevis are irritated and constricted. This often causes friction within that narrow sheath, and this DeQuervain's disease is one of the most common types of tendon inflammation known as tendinosis and tendon lining inflammation, which is tenosynovitis. To go a little further into depth, the mechanism of DeQuervain's includes the APL and the EPB tendons being pressed against the radial styloid by the extensor retinaculum. So, if we were to look at where the hand looks like, with a really great picture there, this being the thumb, the patient would complain of pain near the radial styloid. This is caused by thickening of the retinaculum, and the tendons may inflame due to acute or repetitive trauma. This can interfere with the normal gliding of the tendons with the sheath, and this can eventually result in a local stenosing effect. The prevalence of the condition tends to be generally with women. They're affected about 8 to 10 times more than men are. You tend to see it with middle-aged women, and it's also seen with pregnant women due to the changes in their body during that time. Causes include direct trauma or injuries to the thumb, overuse such as repetitive grasping, or certain inflammatory conditions such as rheumatoid arthritis. Thus, the onset of DeQuervain's can be either a one-time traumatic event or can occur due to overuse. The specific cause is generally unknown, however, so it does tend to be an overuse disease. In order to diagnose DeQuervain's, the golden standard generally used is called the Finkelstein's test. This test is done by placing the thumb within the hand and clasping the fingers around the closed thumb. Then the wrist will be passively ulnarly deviated, meaning towards the pinky side of the hand. A positive test indicates that the patient may have DeQuervain's disease, and the result is pain over the radial region of the hand. Other causes of these symptoms could, however, be arthritis or other forms of tendinitis, so it's important to clear all other possibilities as well. Common signs and symptoms of DeQuervain's include, as said before, pain over the radial styloid, including tenderness and swelling. So patients may have pain due to direct pressure over the radial styloid or the anatomical snuff box. Pain often comes on with thumb and wrist movement, including with forming a fist, grasping or gripping, and turning the wrist. As such, pain can also travel up the forearm, though it tends to be worse at the thumb region of the hand. The patient may feel catching or snapping when moving the thumb, and patients who take part in gardening, racket sports, or other various workplace tasks are probably more susceptible to developing DeQuervain's disease. To summarize, potential clinical findings in the physical exam include a gradual or a sudden onset, though gradual tends to be more common, with swelling and tenderness present over the radial styloid and anatomical snuff box. Thumb motion may be difficult and painful for the patient.
Okay, now for the PT interventions. So, external support is one thing that you can use to help your patients with DeQuervain's. Splinting has been a really effective thing to do to just help immobilize all of those tendons and the tendon sheath that could be causing pain. And it's recommended that the splint be worn 24 hours a day for 3 to 8 weeks with about 1 to 2 hours off to do strengthening and stretching exercises. Also, kinesiotaping has been proven to do about the same kind of thing as the bracing. And if you look right here, we've included a link for how to tape for DeQuervain's. Modalities that you could use would be ultrasound, heat, ice, and really anything else that would help ease your patient's pain. The purpose of these, like I said, is just to help reduce the inflammation and reduce their pain. And the biggest determining factor for which one you want to use is just what your patient prefers. Therapeutic exercise is something that you would want to work on with your patient also. For stretching, you want to make sure that you stretch the wrist flexors and the wrist extensors, and also intrinsic and extrinsic thumb muscles. For strengthening, you would also want to strengthen all of those same things and also work on eccentric exercises, because that's really been shown to help heal up DeQuervain's. And if you look right here with the picture, it has some examples of different exercises that you can do. And here's some links that I've provided just to help give you some more ideas. They're about a minute long each and just give you a quick example of a home exercise program and some good eccentric exercises to work on with your patient. Manual therapy has also been shown to help patients with DeQuervain's. Soft tissue mobilizations to the two muscles involved can really help, especially if there's trigger points involved. Also, transverse friction massage to the first dorsal compartment can help ease some of that pain. Mobilizations to the carpal bones has also been shown to help. And some clinical research does suggest that cervical mobilizations can help decrease the symptoms of DeQuervain's, so treating the whole upper extremity rather than just the wrist and the hand. Okay, and prognosis. So in a retrospective study, they showed that conservative treatment was very effective, but only for patients with minimal symptoms. And as you can see, the percentage of patients who got better decreases as the symptoms become more severe. But one thing to note about this research article was that the conservative treatment they used was only splinting and NSAIDs. So it's a lot less than everything that we just described. So I'm sure with everything put together, it'll probably be a higher percentage of those that get better with conservative treatment. There's also a lot of case studies that dealt with the prognosis of physical therapy treatment, and it showed that they had much more favorable outcomes with the use of education and splinting, manual therapy, and TheraX, with everything combined together. Outcome measures. So the three main outcome measures that can be used to help people with DeQuervain's are the DASH, the Quick Dash, and the PRWE, which is the patient-related risk evaluation. And so all of these you can have your patient fill out at the beginning of your treatment, and then can also be used to track their progress along their treatment. And these are our references. Thank you so much for listening.